I'm Dr. Blanche Grube. Today I'd like to talk about your 6-month dental checkup. Nearly everybody knows or believes that you should go to the dentist every 6 months. Where did that come from? Who says it's every 6 months? Why not once a year? Why not every 2 years? Why not every 5 years? In fact, I know some people who would say, how about never? Right? Well, okay, but most people know it's every 6 months. Where did that come from? Well, years ago, there used to be an old radio talk show called Amos and Andy. And it was sponsored by a company that made toothpaste. Pepsodent, as a matter of fact. And they would have a little commercial about Pepsodent toothpaste. Well, at the end of one of the commercials, Amos says to Andy, Andy, how often should you go to the dentist? And Andy replied, oh, I don't know, I guess about every 6 months. And that was it. It became dogma. From then on, everybody believed that you should go to the dentist every 6 months. Funny thing happened also. Dentists began to do cleanings on patients' teeth. They started removing what people would call tartar. In dentistry, we call it calculus. It's actually a buildup of inorganic calcium on your gums and your teeth, mixed in with some bacteria, some townhouses, condominiums, kind of places like that they like to live in. And so people go to the dentist every 6 months primarily to get a cleaning. In other words, to get this calculus and tartar moved off their teeth. Then they leave the dental office feeling really good because they've got that nice, shiny, clean mouth. No tartar, no calculus. I believe the problem with this is they walk out of the dental office thinking that they are now healthy. Couldn't be any further from the truth. If your body is dumping inorganic calcium into your mouth and you're building up tartar, especially in the back of your lower front teeth, you have a problem with metabolism of minerals in your body. Your body chemistry is out of whack. You should not walk out of the dental office thinking you're in great shape. In our office, patients always ask me, Doctor, when would you like to see me for a cleaning? And my answer is always the same. Never. They're always surprised. Never? I thought we were supposed to go to the dentist every 6 months for a cleaning. How bizarre is that? Do we go to the physician and ask him to give us a shower? Do we go to the eye doctor and ask them to wash out our eyes? Do we go to the ear, nose, and throat doctor and ask him to take a Q-tip and clean out the wax in our ears? Absolutely not. We expect that those parts of our bodies are taken care of on a daily basis in our own homes. So why do we go to the dentist and ask them to clean our teeth? We do that because the situation gets out of control. The situation gets to the point where we can't clean our teeth ourselves. The situation gets so bad that our diet is so bad that we're constantly dumping inorganic calcium onto our teeth, and we can't brush it off ourselves. The point is, yes, you need to go to the dentist, you need to get this stuff cleaned off, but you need to also find out why you're forming it to begin with. You need to get your blood chemistry checked, you need to get your blood chemistry balanced. And the only people that I know that know how to do that are those dentists who have been trained by Dr. Hal Huggins, those dentists who are members of the Dr. Huggins Alliance that know how to look at a blood chemistry and know how to balance it properly. You need to do this for yourself. Don't just get a cleaning every 6 months and walk out of the dental office thinking you're perfectly okay, because things are not.